When we talk about substance use disorders or substance abuse, we are talking about a pattern of use when it comes to things like alcohol or other substances that we know, whether illegal or legal, in a manner that is disruptive and is problematic to someone's functioning. By functioning, I mean how they're carrying out their day-to-day tasks. You know, there's interruption in that. And it also starts to interfere with things like their relationships and also their physical health and also their mental health. So when we talk about things like alcohol, you know, nicotine or cigarettes or tobacco, when you talk about even caffeine, what we find in our teas and coffees, those are some of the recreational drugs around, and they're legal. Yeah. So these are actually chemical substances that affect our brain, that affect also our physical bodies. One of the major things, especially when it comes to things like alcohol, cocaine or heroin, it has a very big effect on the brain chemistry. So you find that the brain chemistry can be changed, especially if, you know, a young adult starts using it, or a teenager for that matter, because the brain is still developing. Yeah, so you find that some of the changes that can happen in the brain can actually be permanent. So you find that, especially in the young brains, the teenage brains, when you get used to that kind of high stimulation, you start to link it with, this is what I should be feeling. Yeah, this is what feeling good means. This normal state where maybe you have a meal, you exercise, you play sports, you have an interaction with, you know, a family member or friends, it stops being interesting because that part of the brain that has learned that pleasure equals maybe alcohol, pleasure equals, you know, smoking something, be it weed or nicotine. So it becomes very difficult now for someone to start enjoying the normal things that we're meant to enjoy. When a substance use disorder develops, it's very slow. It's a slow process. You don't start from, you know, using alcohol maybe 2 beers in a week or 4 beers in a week to being an alcoholic the next day. So it's something very gradual. It's something that takes a long time to develop. So it obviously depends on the biology, yeah, of your system. If you're trying to get the person in for treatment, sometimes it helps to have a discussion with the person and just tell them, you know, in a very calm way, you know, that you have noticed that there are changes that you have noticed, you know, when it comes to their behavior. The reason for that is because you don't want them to close up. Yeah. So showing concern, that genuine concern, first of all, is important. Now, because most of the times you find that they may not agree that they have a problem. So if you're a partner, you know, you can seek the help of their family and just see whether there's someone who they really respect and can listen to them. Once they come into an institution like this, the first thing is just to assess, yeah, the severity. Yeah, so they will sit down with a psychiatrist or a doctor just to assess whether their level of use has gotten to the point of dependence or addiction. When I say dependence and addiction, it means that this person, the tolerance is very high. They need a very large amount of, say, the alcohol in order to feel stable or to feel calm. And then there should be presence of withdrawal symptoms. We also assess for underlying mental health conditions, because for substance use, it's very rare to find that it's just an alcohol issue or it's just a heroin issue. There's always something that is pushing this person to seek out substances. Now, after the assessment, if it has been determined that someone has gotten to the point of addiction, they're taken through detoxification, which takes care of their physical system, because other than the brain being affected, the other organs in the body have also been affected. Yeah, things like the liver, the heart, the kidneys. Yeah, so there are various tests to also check how much damage has been done to these organs, so that we know how to help these organs recover. But then also there are those who may need medication to stabilize things like their sleeping pattern, because when this person is not having access to the alcohol, they're unable to sleep. So they have to, the sleeping pattern has to be regulated, also their eating patterns has to be regulated. And then even during that process, you get to now start doing the one-on-one type of therapy, where you're getting to understand the reasons behind the use. Sometimes we find that the addiction or the substance abuse can cause things like depression, but then there are also those people who you'll notice that the reason why they actually even got into the drinking or the abuse in the first place is because they were going through, you know, emotional challenges, yeah, and they were unable to cope. Now with addiction, it doesn't stop there. They need to go also into a different type of treatment program that takes approximately 3 months. So that's where rehabilitation takes place. As a society, we need to get to a place where we are not ashamed of talking about certain issues. Openly talk about the consequences, yeah, of these substances from a very young age, that a child is aware that there are certain drugs around and these are their effects. It's important to see your child as an individual, as a person who is going through their own processes, and just be empathetic with the situation they're in. That is with the prevention bit in adolescence. But early treatment or early just seeking help, because even with adolescents, they're also going through mental health challenges. So you never know. So if you have that bond with your child, you can actually be able to tell whether their mental health challenges began first before they started experimenting, or vice versa.